Hi, I'm Marcus Plescia, Chief Medical Officer for the Association of State and Territorial Health Officials. I'm going to be talking today about a resource we've been developing for state public health departments called the Essential Policies for Chronic Disease Prevention. Every year, ASTHO does an analysis of state priorities, particularly from the state health improvement plans that each state does. These analyses have shown that chronic disease prevention and control is consistently a top priority in every state health department every year. As a result, we've put together this list of evidence-based policies that we think every leader should consider if they want to improve the burden of chronic disease in their states. Many state health improvement plans specifically mention tobacco control as a core part of their chronic disease prevention priorities and approaches. So in reviewing these essential policies, you'll see that a lot of the essential priorities impact tobacco control. These include increasing taxes on all tobacco products, creating and enforcing model comprehensive tobacco-free air policies, restricting all forms of tobacco product advertising, restricting all tobacco product flavors, including menthol, protecting local authority to enact tobacco control policies by preventing or eliminating preemptive state tobacco policies. And finally, enacting policies that increase access to tobacco cessation programs. We've analyzed reviews of state efforts on each of the essential policies, and we were pleased to find that many states are making significant progress in implementing all of them. But there's great opportunity to build on this momentum. One of the strategies we suggest is for state health leaders to work closely with tobacco program managers on these policies. Tobacco control programs hold invaluable insights about effective policy options and interventions that work well in each state. And they're highly skilled in developing statewide campaigns to promote policy changes. State and territorial tobacco program managers should often meet with their state health agency leadership to discuss the tobacco control policies and assist them with these efforts. In addition to ASTHO's Essential Policies for Chronic Disease Prevention and Control, we also suggest you review the Tobacco Control Network's policy recommendation document and the Surgeon General's recent report on tobacco cessation to identify shared statewide priorities and areas of work. Finally, we suggest you consider realigning statewide tobacco control goals with the objectives of Healthy People 2030. Tremendous progress has been made to reduce tobacco use in our nation, but there's more work to be done. We hope that the chronic disease essential policies will be a helpful tool for you as you make further progress with these important areas.
Andy Baker-White, Senior Director for State Health Policy. Over the last few years, data has revealed a dramatic rise in e-cigarette use among youth, as well as the negative health impacts of e-cigarettes. In response to this evidence, states and territories have developed and implemented policies aimed at reducing e-cigarette use among youth. In the fall of 2019, state health officials in Regions 1 and 2 coordinated a comprehensive response to address the issue. The state health officials asked ASTHO to provide a list of evidence-based policy options for reducing youth e-cigarette use. The result was a repository of policy options and recommendations based on best practices, federal recommendations, in consultation with experts, advocates, and other stakeholders. ASTHO reviewed several policy interventions for e-cigarette use, such as restrictions on e-cigarette flavors, including mint and menthol, sales restrictions based on nicotine concentration levels, prohibiting bulk purchases of e-cigarette products, increasing the price of e-cigarette products, the inclusion of e-cigarettes in clean indoor air laws, restrictions on e-cigarette advertising and points of sale, and restrictions on internet sales. ASTHO also included a review of enforcement considerations that cut across all the policy options. For each of the policy options, ASTHO presented an overview and summary of the policy's evidence base, the key considerations and components for each policy, the counter-arguments industry would most likely make in response to the policy, and links to additional resources. ASTHO's collaboration with Region 1 and 2 state health officials proved a success. At least one state health official shared the information with the governor's office. In the end, ASTHO was able to provide health officials from adjoining states with a single source of comprehensive policy options as they work together in a coordinated effort to reduce e-cigarette use among youth.